Hello and welcome to Medical Shorts by Tutor IMG. In this video, I'm going to tell you how to make a diagnosis of generalized anxiety disorder. As the name indicates, the generalized anxiety disorder is characterized by excessive anxiety and worry about everyday life events when there is no actual reason for that. In order to make the diagnosis of generalized anxiety disorder, the symptom has to be present for more days, not just for 6 months. So there is a mnemonic to remember the symptoms of generalized anxiety disorder. So the patient should have more than 3 of the following symptoms. So B is for blank mind. E is for easily fatigued. S is for sleep disturbance. K is for keyed up. The patient is very restless. I is for irritability. M is for muscle tension. The patient should have more than 3 of the following 6 symptoms. Coming to the treatment, so we start with the lifestyle changes, right? So we will advise the patient to decrease intake of alcohol and caffeine, sleep hygiene, which is very important. Psychotherapy, especially the cognitive behavior therapy, with relaxation techniques. In pharmacotherapy, the most important drugs and the most effective one is basically SSRIs, or we can prescribe them SNRIs. Both of them are very good medication, but the problem is that they take time to take effect. So in order to relieve the anxiety for the short term, you can give the patient benzodiazepine as well. Because SSRI usually takes 8 to 10 weeks to take it effect. So if you have to control the anxiety acutely, so benzodiazepine are good medications. For long-term use, SSRIs are excellent medication. So if you like this video, kindly subscribe to the channel Tutor IMG, and thank you very much.